So the question is about Keynote 42, which, as we all know, was in the plenary session, and it was all non-small cell lung cancer, all histologies, rather than just the non-squamous, non-small cell as we had previously seen. And there were more than 1,000 patients, actually 1,200 patients or so, randomly assigned to receive chemotherapy with or without pembrolizumab, and they needed to have greater than 1% positivity. We did have an abstract earlier in the day where they even took those with less than 1% that were presented by Dr. Luis Paz-Ares, and that study was positive also and had more than 500 patients. So we now know that the whole spectrum of PD-L1 status benefits from dual therapy. So these positive results are very encouraging. What was interesting was that patients who were below 50% and above 50%, they both benefited with the addition. And earlier in the day we saw by Dr. Luis Paz-Ares, his keynote trial presentation, which also included both histologies, that the three groups, 0, 1 to 49, and greater than 50, all benefited, and the higher expression patients from 1 through 100 were better than less than 1, but the hazard ratios of the top two groups were very close to each other. So I think this will definitely change the standard of care. These are practice-changing studies.